Hi everyone. So today I will be talking about a disease called amyotrophic lateral sclerosis, which is a neurodegenerative disease. Oops, is my screen not working? Let me do that again.
It was working, Srishti. We can see everything.
Okay, perfect. So I'll be talking about amyotrophic lateral sclerosis, which is a neurodegenerative disease. So, in the presentation today, we will be going through So what is ALS, is conventional therapies, is innovative therapies, and doing an evaluation or conclusion of my research in general. Is the screen share not working again?
It popped off, but now it's back on.
Okay.
It,
So what is ALS? ALS is a neurodegenerative disease affecting the motor neurons, and it ultimately leads to paralysis and motor function failure. So many patients who have this disease struggle to move, have respiratory struggles, and have inhibition of movement. The criticality of this disease really lies in its mortality rate because while it is rare, only 10% of all ALS patients in the United States survive after 10 years of onset, which is a very low survival rate. So as you can see in this image, there is a normal motor neuron with optimal muscle contraction, and then there is a motor neuron which is damaged by ALS. As you can clearly see, it's very shriveled and it's unable to contract. There are two causes to ALS. There are genetic causes and there are sporadic causes. So in regards to the genetic causes, ALS is caused by the SOD1 mutation or the C9orf72 protein mutation. And then there are the sporadic causes, which, as the name suggests, it is very unknown and requires a lot of research as to why this persists. So in regards to the conventional therapies, they really address the symptoms of ALS in order to improve the quality of life for these patients. There are 5 drugs approved by the Food and Drug Administration in order to do so. So the first one is calcium or tofersen, and this is an antisense oligonucleotide or ASO therapy, which is directed toward targeting the mutated SOD1 enzyme. So an antisense oligonucleotide therapy is really one that targets the mRNA produced from the damaged mutated SOD1 gene, complements it, and induces apoptosis in the cell. In regards to this, there are 3 clinical trials. The first one is a phase 1 clinical trial. And this examined the SOD1 level in spinal fluid of 50 participants, and there was shown that there was a lowered SOD1 mutation. However, this population was not very comprehensive of all the people who have ALS since it only consisted of 50 participants, so results should be taken with a grain of salt. And then there is the VALOR trial, which is the phase 3 clinical trial, which was conducted on a comprehensive amount of patients over a long amount of time, but unfortunately, it did not have statistically significant results. And then there is the ATLAS trial, which is projected to conclude in 2027. And then there is Radicava, which is another drug, and this is an antioxidant therapy targeting muscle degradation, which is something that happens as a result of ALS. So its mechanism. There are these specific compounds called reactive oxygen species, and what they do is they build up an accumulation and destroy the motor neurons. And so what Radicava drug does is it captures these reactive oxygen species in order to protect the neurons. In regards to clinical trials, there was a double-blind placebo trial that was conducted in Japan. And number 1, it didn't have statistically significant results. And number 2, was not very representative of the whole population since it was only conducted with Japanese people. Additionally, a placebo study was conducted by the German Motor Neuron Disease Network, and results were not statistically significant. Before I go into the next 3 drugs, I want to take a minute to introduce glutamate and ALS and their correlation. So glutamate is the neurotransmitter primarily associated with excitation. And so excitotoxicity is when this occurs in excess, and there is an overactivation of glutamate, which leads to cell degeneration, neuronal cell death. And so this is really attributed with the sporadic cases. In fact, 40% of all sporadic cases in ALS are caused by glutamate release. So there are 3 therapies that specifically target this. The first one is Riletec, and this inhibits glutamate release. And there was a clinical trial conducted with 959 ALS patients in Europe, and there were statistically significant results. However, the study was conducted in 1993, and so its results may not be as accurate when we are in 2024 right now. And then we have Exervon, and this is basically the same mechanism as Riletec. However, it takes patient ease, accessibility, and comfort into consideration. And so this is in the form of an oral dissolvable film. So patients who are paralyzed and do lack those motor function abilities, as you can see in this image, can just place the drug atop their tongue and it will dissolve on its own, delivering the drug to the body. And then we have Teglatic, which directly works with the glutamate signaling pathway. So basically just inhibits reception in order to reduce the production of glutamate. And then now we have innovative therapies, and this is what the bulk of my research focuses on, which are 3 specific innovative therapies. What's so special about these therapies is they really target the root of the problem rather than just providing a short-term solution, which isn't really statistically significant, as we could see with the conventional therapies. So these 3 methods are gene therapy, which silences harmful genes by replacing the mutated gene with a healthy counterpart in order to decrease the expression of the harmful gene. And then we have a monoclonal antibody therapy, which really works with the immune system to serve as a substitution for antibodies to restore optimal cell function. And then we have stem cell therapy. So stem cells are cells that can function as anything. So they can just replace these harmful cells or cells that are not really working properly in the body in order to restore optimal cell function. All right, so under gene therapy, we bring back ASOs again, which, if we can recall, Qalsody is also based off of. So it has the same mechanism with complementing specific mRNAs and inducing apoptosis in them. In regards to clinical trials, there was a phase 1 and 2 clinical trial, and it was found that there was a significant reduced concentration of the SOD1 mutation, which is an excess in patients with ALS. And this trial is also proceeded towards phase 3 in order to obtain more results. There's also something called RNAi processing under gene therapy, and this has the same mechanism, except it does it through something called an RNA-induced silencing complex to inhibit the expression of the harmful genes. This, I want to point out, is definitely more promising just because RNAi is double-stranded, and so it's more sustainable. In regards to clinical trials, there is a mice model with the SOD1 mutation, and there's a 39% survival benefit, so this really does have potential. All right, now moving on to monoclonal antibody therapies, the one specifically related to ALS is AL0011. And this targets not the SOD1 mutation, but the C9orf72 gene. So this is actually present in decreased amounts in ALS patients. So we really want to increase these amounts. So what this does is it triggers the immune system in order to increase the concentration of this protein in order to stop the progression of ALS. There is currently an ongoing clinical trial with this therapy as well. There's currently an approved monoclonal antibody therapy called ozanimumab, and this specifically targets something called a nutrite outgrowth inhibitor. So really, if you look at the name, nutrite growth inhibitor, it really just prevents the growth of your neurons. It's also known as NOGO-A. So what this does is it stimulates the production of neuronal activators in order to really balance the activity of NOGO-A in order to stop the inhibition of neuronal cell growth. There is currently a placebo trial, but there was not a significant effect of the drug compared to the placebo. In addition to that, there was also increased respiratory side effects, which we already know is a symptom of ALS. So it really just harms the patients more. And then we go to stem cell therapy. So this targets something called the glial cell line-derived neurotrophic factor, or GDNF. And basically, this is a neuronal protector. So what this does is it engineers stem cells to produce GDNF to protect the neuron's function, treating ALS. There is currently a phase 1 out of 2 clinical trial that only validated that this approach was safe. Although this may seem trivial to say out loud, stem cell therapy is very invasive, and so validating the safety of this procedure is a huge step to really ensuring proper innovative therapies. So in conclusion, conventional therapies not as sustainable and really short-term solutions, while innovative therapies are sustainable, do have long-term solutions, but require extensive research to really get development. And so these are the references I used for today's presentation. And I want to say thank you, and I would love to open the floor to any questions.
Wow, thank you, Srishti. That was wonderful. Thank you all for listening. Can you please, if you have questions, feel free to add them in the Q&A. We have some that have come in, and we'll answer a few of those. Okay, so Srishti, one of the questions that I see here is, what was the most interesting or unexpected thing you learned about ALS treatments during your research?
I would really say stem cell therapy was probably the most interesting thing I learned because it really seems to have such a simple methodology, but its application is so difficult because in the methodology, stem cells are just any cell that can replace something else, but they haven't been used so often because of the safety factor. So it was really interesting to learn that since this approach was safe, I could use it for ALS.
Wonderful. What do you think could be the next big breakthrough in ALS treatment based on what you've studied, if you've thought about that?
Yeah, I have thought about it. I would say monoclonal antibodies actually do have a lot of promise just because there is already a drug approved for that. So there has been extensive research gone into that. And I'd say like with zanazumab having a couple tweaks to really get rid of the respiratory harm, I think it has a lot of potential.